The COVID-19 pandemic has deepened existing inequalities, with children and young people's voices and needs really being considered in policy decisions. This is according to new research by experts from South Africa, Brazil, as well as the UK. They found pandemic policy decisions largely ignored young people's needs, with the resultant long-term impact on their health and welfare. So to talk more about these findings, I'm now joined by Dr. Abraham Matamanda from the University of the Free State. And Doc, thank you so much for your time and good morning to you. This is quite concerning. I mean, after lockdown, the lockdown COVID-19 pandemic, it seems we're still seeing the effects of the pandemic, but this time around identified within, young people's lives and children's lives. Talk to me about how these, effects have deepened inequalities in this regard.
Okay, good morning. Thank you so much. I think when you look at the COVID-19 pandemic, when it happened, we thought, it has vanished away from us. But what we came to realize with our study and the findings that we have actually come through is that there have been a lot of inequalities that have been exacerbated by this pandemic. And especially with our study, we're looking at three facets of life that include play, food, and education. So what we have found is that the aspect of education, there was little regard that was done to it in terms of really understanding how the lockdowns could really impact those young people from poor households. And there was the introduction of virtual learning and all those things. And we found that these students did not even have, some of them did not have access to learning material. They didn't have a conducive environment in which they could actually learn very much. So what we are finding out now is that a lot of them have been left behind in terms of catching up, in terms of some cognitive development that they lost during the lockdown period and when the schools were also closed as well. And what is also coming out strongly from our studies is that the aspect of food, we realize that the school play a very, very critical role in terms of food access and food availability for most of the young people and children coming from poor households. Because what we found that is that at school, they get some food through the feeding schemes. So what this study has also revealed is that schools really are an important hub in terms of children accessing food as well. So a lot of inconsistencies have come from that as well. So another dimension which is very, very shocking is how the pandemic really, the strategies that were adopted, they gave little attention to the aspect of leisure and play for the children who were confined indoors. They didn't have time to play, and this really affected their mental and emotional well-being.
Yeah, and as part of your as part of your recommendations, Doc, I find it so significant that within the study you mentioned that there is a need to keep children and young people at the center of pandemic preparedness, right? So it seems that that's one thing that was lacking. But right now it has shown that there is a need to ensure that when we carve out COVID-19 policies or even pandemic policies in general, young people and children need to be at the heart of that preparedness.
Yeah, I know. You see, this is a very a worrying situation, but it's also maybe to do with the COVID statistics that we were getting, that when the pandemic came through, we realized that a few children and young people were being affected in terms of by the actual COVID-19 as a disease. But then what we then realized is that we actually forgot to incorporate the needs of these young people. And this came out through their need for play, their need for leisure, and even the emotional support. Because what we are finding here is that there were some children who ended up taking some major responsibilities, like they were staying with their parents who would get infected, and then they had to take care of those people because of the social distancing and lockdowns. Sometimes there were no social capital and assistance that could come in. So even the emotional support and the psychological support that these young people have gone through, it has not really been integrated into our strategies in terms of coping with COVID-19 beyond the actual pandemic period that we have actually witnessed in the past years.
Yeah. Then what are some of the recommendations and forms of interventions then do you provide within the study moving forward?
Okay, so with this study, we really came up with 5 recommendations. So the first one that we really, which speaks to the conversation that I've been giving, is that we realized that these children and young people were not at risk. But then also we realized that not at risk is also being at risk as well, because they actually became forgotten. Like their voices were not incorporated. What really did they want in terms of coping with the COVID-19? And another recommendation that we actually make is that we also need to incorporate the voices of the young people and the youth in terms of the policies that we come up with. And instead of making it a top-down approach in terms of mitigating and adapting to the pandemic, we need to incorporate the voices of these young people as well. So the other recommendation that we make is that policymakers need to understand the value chain around which children really operate. And this is also that schools are an intricate hub in terms of accessing play and then food as well. So when policies are being made, like when the lockdown was done and then schools were closed, a lot of children were cut down from the food that they could be actually accessing at the schools. So that also was not really integrated into the strategies. And the other fourth recommendation that we make is that playing is a right. But so we realized with the pandemic and the strict lockdown, children had to be kept indoors. But this is that time of their development where they need to be socializing and playing with other children as well. And this was not really factored in. And it's as we dig deeper, we realize that there's little attention that is being given in the policies to the playing needs of the children and youth. Then we also realize that there's a need for a multi-sectoral caring in the face of supporting. So instead of just looking at one aspect, like when they closed the schools, they were supposed to look at how it affects the other facets of the lives of the youth. Yeah.
I also found it interesting that you make mention of the hidden voices, and that's important, right? Because there are voices that can be ignored, that are hidden, that are not considered when making such policies. You say these are hidden voices, oftentimes found in poorer communities and from poorer backgrounds. How significant and important is it, Doc, to look for those voices, to find them and include their inputs when, of course, finalizing policies around pandemics?
Yeah. So you see, when you look at this aspect of these hidden voices, it's also maybe to do with the nature of the pandemic, the way it happened, the swiftness of the responses that were required and all those things. But what we have realized is that when we also juxtapose this pandemic in light of the Sustainable Development Goals, we also realize that it is very critical now to also consider the voice of these young people, and especially from these poor households whom we normally neglect in policies. So this is a persisting thing that we're actually even seeing. So it is very critical that I think in some of the studies that we've realized, there is that disconnection between the authorities and then these poor people, where we don't know what they need, but we assume what they need. So it is very critical that we have people-centered policies that are also speaking to the needs of the people. What are their fears? How best we can integrate and then calm them down as well. Because there is an element that's also coming out that there was a miscommunication. People didn't trust what the government was giving down and all those things now. So with effective communication, I think it's also some of the things that was actually lacking as well. So there was need for dialogue as well between these people, what they need. We explain in detail what this pandemic is really about. Yeah,
absolutely, Doc. And you're making such an important statement there, being in dialogue with the people so we know what they need and not assume. Dr. Abraham Matamanda from the University of the Free State, thank you so much for your time this morning.